Welcome back to the program. I'm Chris McCutcheon, and you're listening to Aging with Options, Louisville's only radio program dedicated to seniors and topics of interest to our senior community and those that care for seniors. My guest in the studio is Dr. Mike Benfield, a physician and founder of MD2U. MD2U provides primary care in the homes of seniors and others who are homebound and home limited. Dr. Benfield, the idea of making house calls is somewhat unique this day and age, but it's certainly not a brand new concept, something that's been around for quite a long time, but making a bit of a resurgence, I guess, right?
That's exactly right. And I think most people, certainly in their 70s, 80s, and 90s, or even if you're 100, you remember the day when the doctor came to your home. And it's interesting, more and more as time has gone by, people have almost forgotten that that's how care was delivered. And so now it seems like a real novel idea. But it's really not a novel idea at all. It just took a break for a while. People made physicians made house calls up until the 50s and 60s. And really what changed then is technology. People were able to get blood tests and urine tests and x-rays and EKGs and echocardiograms and all kinds of tests done in doctors' offices. And so doctors really needed that kind of information. And so in order to get that, they had to bring patients to them in order to utilize these pieces of equipment to get that information. And as time has gone on, technology has again changed to where those pieces of machinery and equipment, which were big, they were really large pieces of equipment, now they're very, very small. An ultrasound machine, is about the size of an iPhone. X-ray machines can be carried in something about the size of a large, suitcase, and things are rolled around, and there are vans now that can take these around. And so when that technology has changed now to become very small and compact and mobile, it makes house calls a very viable, way of serving patients, and in my opinion, it's really one of the best ways of being able to deliver individualized and personalized care, to patients in the home. And so when technology has changed that way, it allowed us to really receive that same information in a timely manner rather than going into an office practice. Now, I was talking with you earlier about how quickly we can get things like an x-ray result. I mean, we can get someone who may have what we suspect to be pneumonia. We can get a chest x-ray, and the results read, that x-ray read by a radiologist, and that report back to us within about 3 hours. And that is very, very fast, and that's not something that's been going on for a long time. And we're really excited about that kind of capability.
And that patient never has to leave their home.
Never has to leave their home. Even if they were to require IV antibiotics for pneumonia, we can get that done in the home too. And I use that term, get that done. We can have that done, or we can use those resources, because we're a primary care practice. And what we do and what our providers do is we go out and we do a history and a physical, and we do an assessment and a plan, and we write orders and we do things. But we have other companies that we outsource, the things that they really do well and are experts at, doing x-rays and getting those x-rays read, or, drawing blood and taking it to the lab and getting results. We outsource those services to other companies who really work in partnership with us to provide this kind of care.
I think it's fascinating. You think of needing an x-ray, you think of going somewhere that takes an x-ray and needing an enormous piece of equipment in order to produce an x-ray, but that can be done right in a patient's living room.
That's right. And that not only is that technology getting smaller, but one of the reasons that it wasn't utilized more often in the recent past was the quality of that image was not up to standards that radiologists could use. That has changed as well, and that quality of that picture that they get with that x-ray is improved substantially and is really effective now.
Interesting. So, Dr. Benfield, for folks that haven't experienced seeing a doctor in their own home, and that's a new concept for them, and they may be concerned that they wouldn't receive the same level of care that they would at a traditional office-based primary care practice, what would you say to that?
Well, I would say that that's really, we are a primary care practice that can do all those things in the home that they can get done in the office. Like I said, when you go to an office-based practice, you're going to get a history, a physical, someone's going to do your vital signs, and then there's going to be an assessment and a plan going forward. One of the things that we, really take a lot of pride in is providing personalized and individualized service, because we only assign 150 to 250 patients per provider, so that we can really know the patient and know their caregivers and their family members, and that really means a lot. And when you go into someone's home, you learn a lot about them. If you're a diabetic and I go into your home and I see candy bars and fruit juices and all these kinds of things in your home, I recognize that either you don't understand how this affects your health, or I need to talk to you more about taking better care of yourself. So you learn a lot about being in someone's home, about them and about how they take care of themselves, and that's an important part of what we do.
It's one thing to ask a patient about their diet. It's another thing to open the refrigerator, right?
Yeah, I always tell patients, I always tell people, the patient, what they say about their health and how they live is never quite exactly right. Or if they have a complaint, it's never exactly what they're saying. It's either a lot worse than what they're saying, or it's not quite as bad. And you really have to go out there and see them and take a look to really understand exactly what you're dealing with as a healthcare provider.
Right. So under your model, then, you talked about assigning your providers to a certain number of patients. So a patient in your practice, in your service, they're going to get the same provider each time they call?
We make every effort to make sure they get the same provider at every visit. And I do need to say that 150 to 250 patients may seem like a lot of people, but compared to, and if you don't know this, most primary care providers have around 5,000 patients that have been assigned to them. And they don't see them as often as we do, because they're typically not as sick. Chris, the people we see are that 5% of the Medicare population that is consuming and utilizing more than 50% of the Medicare resources. And so these are very sick people. They're homebound or they're home limited. So you don't get into that situation unless you have some real serious problems to deal with.
In addition, just to the convenience of being able to be seen and treated in your own home, are there other advantages to receiving medical care in your home, aside from the convenience part of it?
Well, we touched on a little bit. You do get a better picture of who's caring for the patient. What are the patient's living conditions? What medications are they really taking? The list of medications may be one thing, but when you go and you get the bottles out and you look at them and you can see, are they taking these medications or are they not taking medications? What kind of supplements are they taking? Are they taking a bunch of vitamins and supplements? What else are they taking? What's in their home? You really get a good picture of that. And so, yes, it provides access to care for patients who need to be seen more frequently than they are typically. A patient with 4, 5, 6 chronic diseases and 10, 12, 15 medications needs to be seen frequently. And we see people typically every 4 to 5 weeks if they're stable and they have these routine problems with that amount of medications. And it's not arbitrary that we do that. When we start pushing patients out to 5, 6, 7 weeks, we start seeing them more frequently in the emergency room, admitted to the hospital, and sometimes they wind up in long-term care facilities.
Well, MD2U helps patients, many of whom are seniors, who cannot make and keep doctor's office appointments, and primary care. MD2U helps patients by bringing primary care to their home. Dr. Mike Benfield is the founder of MD2U, is my guest on the Aging with Options show. We'll be back with much more right after this break. You're listening to Aging with Options on 970 WGTK.